30 minutes. His medical history is significant for smoking and hypertension. An ECG reveals new T-wave inversions. The healthcare provider suspects acute coronary syndrome and orders a troponin level to be drawn. All right, troponin is a protein found in striated muscles, including skeletal muscles and the myocardium of the heart. There are three types, C, I, and T. Troponins I and T are highly specific to myocardial tissue, and together they are known as cardiac troponins, or CTN for short. Now, cardiac muscle cell, or myocyte damage, can occur with acute coronary syndrome, which is any condition that decreases blood flow to the heart muscle, such as angina or a myocardial infarction, or MI for short. Decreased blood flow causes an imbalance between myocardial oxygen demand and supply from the coronary arteries, resulting in myocardial ischemia and damage to cardiac muscle cells. As the cell membranes become damaged, cellular contents are released into the bloodstream, including proteins like CTN and enzymes like creatine kinase-MB, or CK-MB for short, which is mostly found in heart muscle cells. All right, so troponin levels will be measured when there is a concern about cardiac ischemia. Troponin levels are usually drawn together with other cardiac biomarkers like CK-MB. Typically, a blood sample is drawn on admission and repeated to monitor for trends in the values, or if there are new signs and symptoms of ischemia, like new findings on ECG or evidence of new abnormalities on imaging tests. High-sensitivity CTN assays, or HS-CTN for short, can detect very small levels of cardiac troponin, so cardiac injury can be rapidly identified or ruled out. Individual troponins can also be drawn. The normal range for troponin I is 0 to 0.4 nanograms per milliliter, and for troponin T is 0 to 0.1 nanograms per milliliter. Troponin levels can be elevated in the blood within 2 to 4 hours after the onset of cardiac ischemia, and usually peak at around 48 hours. After that, they remain elevated for about 7 to 10 days. Let's look at the nursing implications for a client with an elevated troponin level. Your priority goal of care is to assist with treatment and prevent complications. Begin by collecting a sample through venipuncture, typically using a tube with a red, red-gray, green, or gold top. Gently invert the tube 5 times to ensure mixing of the clot activator in the tube. After collecting the sample, deliver it promptly to the laboratory. Next, administer prescribed medications like aspirin to inhibit platelet aggregation and clot formation, morphine and nitroglycerin to promote vasodilation of the coronary arteries, and oxygen to increase oxygen delivery to the heart. Place your patient on continuous cardiac monitoring and create a calm environment by dimming the lights and limiting noise. Draw repeat blood samples for troponin analysis per provider order and prepare them for cardiac interventions as needed. All right, as a quick recap, troponin is a protein found in striated muscles, including skeletal muscles and the myocardium of the heart. There are 3 types, C, I, and T. Troponins I and T are highly specific to myocardial injury, and together they are known as cardiac troponin, or CTN for short. Troponin levels increase when there's damage to the cardiac muscle cells, which causes the release of troponins and other cellular contents into the bloodstream. Troponins are usually drawn together with other cardiac biomarkers like CK-MB when a myocardial ischemia is suspected. Nursing implications include assisting with treatment and preventing complications.